Good afternoon, everyone, and thank you for joining us for this week's COVID-19 briefing. In keeping with our customary routine, I'll turn things over to Dr. Fitzgerald for an update. Dr. Fitzgerald.
Thank you, Minister. Good afternoon, everybody. Thanks for joining us. Since the media advisory yesterday, we have one new confirmed case of COVID-19 in our province. The individual is between the ages of 30 and 49, and the case is travel-related. The total number of cases in our province is now 1,382, and there have been 7 new recoveries since yesterday, leaving 35 active cases in the province. There are no hospitalizations associated with COVID-19, and a total of 155,424 people have been tested to date. Effective yesterday, we entered the transition phase of our reopening plan, easing some outdoor restrictions within the province. Community fireworks, parades, and outdoor ceremonial events are now permitted with physical distancing between individual groups, and outdoor formal gatherings can increase capacity to 150. As well, yesterday we announced that the Atlantic Bubble will reopen effective 12:01 a.m. Wednesday, June 23rd. This means there will be no self-isolation requirements for residents of Atlantic Canada, provided they are asymptomatic at the time of travel and have not traveled outside the Atlantic region within the last 14 days and have not been in close contact with a person with COVID-19. Atlantic Canada residents will need to fill out the travel form prior to arrival and show identification at their point of entry to verify that they are residents of one of the Atlantic provinces. Any resident of Atlantic Canada who arrived in the province before the bubble opens and meets this criteria can leave self-isolation effective 12:01 a.m. on June 23rd, when the change in the special measures order takes effect. At this time, the Atlantic provinces have a similar epidemiology to ours, so we are comfortable easing this restriction next week. We continue to see steady and significant declines in new COVID cases across the country. There are less than 1,000 new cases being reported daily in Canada, which is tremendous progress. All indications are that the third wave is subsiding, and this reduces the risk for everyone. And we certainly see the impacts of this with only 3 travel-related cases in the last week. This is one of the indicators that we've been watching closely as we move towards our target date of July 1st for reopening to non-essential travel. Of course, our provincial vaccination rate is one of the criteria required in order to move to step 1. And as of Monday, approximately 72% of our eligible population has had at least 1 dose, and we anticipate that we will reach the 75% mark this week. Although we will soon reach this important milestone, the targeted date for reopening will still be July 1st. There is a significant amount of work required to prepare for reopening the province to travellers. And while many families are busy getting their homes and guest rooms ready for relatives to return, we too have much work to do behind the scenes. In particular, staff are working on creating a new technology platform for travellers to submit proof of vaccination and pre-arrival tests. Regional health authorities are preparing for increased testing demands with more travellers entering the province, and all these elements take time to build, but they are important to help us open to a way that is safe and helps reduce the risk for both residents and visitors to our province. We are also changing our definition of fully vaccinated to align with the federal definition. This will help reduce discrepancy and confusion for travellers. An individual is considered fully vaccinated 2 weeks after their second dose of a vaccine such as Pfizer, Moderna, or AstraZeneca, or 2 weeks after a 1-dose vaccine such as Janssen. It is also important for everyone to continue applying our layers of protection. With restrictions easing and the province reopening to non-essential travel, many may assume that the risk of COVID has passed. It has not passed. It is still real and present, even if it is lessened. Public health applies restrictions proportionate to the level of risk, and we are easing restrictions as we see improvements in epidemiology and as more people get vaccinated and protected. So please remember, even throughout our reopening, wear your mask in public spaces, physically distance from those who are not your close contacts, wash your hands or use hand sanitizer when entering and leaving public spaces, choose outdoor gatherings over indoor gatherings, and indoor gatherings should still only be with your close, consistent contacts. When you do gather with others, avoid sharing food, drinks, and other items. Most importantly, please make the choice to be vaccinated. Almost 30,000 individuals, or about 6% of our eligible population, are now considered fully vaccinated. We have received notification that our vaccine supply will significantly increase in the coming weeks, and we expect to receive about 183,000 doses between now and the end of June. As a result, regional health authorities will be moving up second doses for everyone. All second dose appointments scheduled on or after August 6th will be automatically canceled. And starting Monday, everyone who had a second dose appointment scheduled on or after August 6th will need to rebook an appointment for an earlier date. When you rebook, you must ensure there is at least 8 weeks between your first and second dose. You can book your second dose appointment through a regional health authority clinic, and some regional health authorities may have second dose clinic appointments available starting today, but the majority will be available for booking on Monday. You can also book a second dose Moderna vaccine through your physician or pharmacy. The National Advisory Committee on Immunization has determined that using a different vaccine for second dose is safe and is effective. And the most important thing is to get your second dose as soon as possible. So don't delay receiving your second dose just to get the same vaccine you received for your first dose. If you received AstraZeneca as your first dose, you can receive your second dose with AstraZeneca, Moderna, or Pfizer. And if you received an mRNA as your first dose, an mRNA vaccine, so that would be Pfizer or Moderna as your first dose, you can receive either Pfizer or Moderna for your second dose. They are both very similar and can be interchanged. Based on an anticipated supply, we are aiming to have 15 to 20% of our eligible population with 2 doses by the end of June, and 50% of the eligible population vaccinated with 2 doses by the end of July. This will surpasses our initial vaccination timeline projections. As a recap for anyone just joining us, there is 1 new case of COVID-19 in our province, and the total case count is now 1,382. We have every reason to be optimistic about the summer ahead and onwards into 2021. From here on in, every day is a step forward in reaching our new normal, and we need everyone to stay the course, keep the pace we set, and continue following public health guidance. And please get vaccinated. Hold fast, Newfoundland and Labrador. Thank you.
Thank you very much, Dr. Fitzgerald. I just have some brief comments to add to yours. As the cases that we see across the country and across the province drop, we're down to a case count of less than 5 per 100,000 as of this last week. We can start to build on our transition phase. The most obvious immediate change from a travel perspective will be the opening of the Atlantic bubble. This will be, as last year, simply those people who live normally in Atlantic Canada and have not travelled outside will be treated no differently than if they lived within this province. The only thing is they will need to fill in a travel form, but not necessarily apply for an exemption. The other difference between this year and last year is that the lack of isolation requirements will be triggered immediately at 12:01. So those people who may have arrived a little bit earlier will be able to end their isolation at 12:01 on the 23rd, assuming they are well and have not been in contact with anyone who has COVID or been advised by public health that they should not do this. The transition phase mentioned in our reopening plan, Together Again, is already underway. Dr. Fitzgerald referenced gathering sizes and community activities. We will start to see a gradual return to work of staff throughout government, for example, as we ramp back up to something nearer our normal work life. We're also working with the regional health authorities now on altering visitation requirements for long-term care in particular. we know that over 90% of the residents of our regional health authority facilities are fully protected with 2 doses for at least 3 weeks in some cases. And so those announcements will be made over the coming days too. Dr. Fitzgerald has referenced vaccination. We are ahead of where we had anticipated, and with additional Moderna coming this week, next week, and again before the end of July, we find ourselves in a situation where we can expedite second doses significantly. Dr. Fitzgerald has outlined in broad terms what will happen, and that process really will start on Monday in terms of people being able to book regional health authority clinics. Pharmacies will also have access to Moderna, as will family doctors who have participated in the vaccination scheme. That will then only require that you wait the 8 weeks. We know this from real-world experience, and this is the best and safest way of administering the second dose to get the best protection. As an aside, our website will be updated and go live tomorrow. This will make a search function available, which should facilitate people looking for particular items of information. Also, we will be showing a dial with second doses along with first as well. From the point of view of communications, we have, barring any mishaps, decided that we will not be issuing media advisories or updating the hub over the weekends, nor on provincial holidays. Obviously, if there is some change in the situation that requires more urgent attention, then this will be dealt with at the time. So again, closing with Dr. Fitzgerald's comments, what we need to do as part of the transition is to continue to wear our masks, continue to keep our distance, and please, everyone, take advantage of the vaccine. Our numbers are excellent. We can get there, and we can get there quicker than we had anticipated. Thank you very much. I'll turn it back to Leslie now for the media.
Thank you, Minister. For the benefit of our speakers, there are 4 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
The last time we did the Atlantic bubble, all the Atlantic provinces were on board with the same measures at the same time. This time, every province seems to be doing it a little bit differently. And I know there's already a lot of confusion because the dates are different for each province. The requirements around vaccinations are different for each province. Why weren't the provinces able to come to alignment on what to do when with the Atlantic bubble 2.0?
I can't speak to the direct process because a lot of these discussions took place through the Premier's office. My understanding is that variations in local epidemiology made it that the advice from their respective medical officers of health meant that they would do things in a slightly different phase, but pretty well everybody would be lined up by July. This was the approach that we were advised would work for us, and that's why we're outlining our arrangements today.
Dr. Fitzgerald, you mentioned that you don't want people to wait in order to try and get the same dose that they got the first time around in terms of Pfizer or Moderna. Have there actually been any large-scale trials of mixing and matching Pfizer and Moderna? And do we have evidence on what the efficacy and safety may be of doing that?
So, what we look at for interchangeability really is to look at why was the vaccine approved, for what reason? So, we know that these 2 vaccines were approved for the same indications, approved in the same groups of people by and large, and have very similar efficacy, safety, and some real-world experience data with regard to vaccine effectiveness. Their side effect profiles are very similar, and they produce very similar. When you get the vaccine, your body produces an antibody to very similar antigens, in fact, almost identical antigens. So what we, based on the principles that we know about vaccine vaccine science, there is certainly everything in place that these vaccines can be interchangeable. With regard to large-scale studies showing effectiveness, there aren't any available right now. The evidence is still evolving, but based on what we know and based on vaccine science, I think it is, quite safe to be able to get a different vaccine the second time around.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. You mentioned the case counts are dropping across Canada. In fact, they're dropping exponentially, even over the past couple of months. Given that, is there a scenario in which the province would accelerate its reopening plan?
I think right now where we are is, it's very difficult actually to say that. If we find that cases plummet and continue to do so with one vaccine, and as bigger provinces start to reopen, we don't see a resurgence in cases, that bodes very well. But I think it's hard to predict that at this point. We really need to see what's going to happen over the next few weeks and what will happen through July. It's very important for us to make sure that we get our vaccination rates up, and having the 80% of the population, eligible population, fully vaccinated, I think is really a requirement for that, free and easy movement in the larger groups. And so if we're able to get there faster and we see that the epidemiology is favorable, those are conversations that we will consider at that time. But I think it would be unfair for me to predict anything at this point.
Okay, thank you. And if vaccines are making such a difference, why, as of July, will we still have two different standards for Atlantic Canadian versus the rest of Canada?
There's no... we don't know exactly. It's hard to tease out exactly what's making the difference right now. Is it vaccines, or is it that, a lot of these, the provinces that were having really high case counts brought in some very strict measures, public health measures that brought the case counts down as well. And we have seen this, in the second wave when we didn't have the vaccination rates that we have now, that when they locked down, the cases dropped dramatically. So there's a combination of things happening. Number one, we've got the public health measures that are in place that are bound to reduce the cases just by that. But then we have vaccinations in place as well. And I think as we open up some of these bigger provinces especially, I think, we'll really start to see the impact of vaccinations at that time, because we'll watch and see what happens with the case counts. So I don't think we can, so with regard to your question as to why is Atlantic Canada different, because our epidemiology is quite different here. We're all at a point now where we're down into very low case counts, and so we all have very similar epidemiology as opposed to other places across the country.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Alberta is making a push to get more people vaccinated with at least one dose of the vaccine after they say demand for first dose appointments has dropped. Are we seeing anything similar here in terms of demand decreasing for those first shot appointments?
The short answer is no, we're not, Richard. It seems that we are gaining ground in those groups for whom vaccination was opened up later. Obviously, as we hit 90%, 85% in the older age groups that we did earlier, the demand there is simply numbers related. So we've used kind of the slack there to concentrate where we could on getting second doses in, but demand is high.
And the interprovincial ferry service has had its capacity reduced during COVID-19. With the reopening in a couple of weeks, and of course those ferry services will play an important role in tourism, has any thought been given to increasing their capacity?
So those discussions, I'm sure, are happening. I don't have definitive answers for you today, but we can certainly follow up with that and get that information for you.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. As the demand for vaccines continues, and I'm sure a lot of people are excited to hear about the second doses now, what has the wastage been like? I'm hearing that at some of the vaccine clinics that at the end of the day, there's a lineup to get through them, but still they have 50 doses left to give.
I don't have any accurate, up-to-date figures for vaccine wastage. The instructions to the regional health authorities were to bring back none, ideally, from those clinics. We are in the process now of setting up extra clinics to ensure that people can get the appointments moved forward when the change comes about next week for second doses. In terms of my understanding on a local level, the clinics, for example, in Gander, they have a short list of telephone numbers for people to call should they have doses left. But there are people who are turning up just on the off chance there may be vaccine left. And I'm not aware of any clinics that have gone away with vaccine undelivered. I will certainly go back and verify that with some up-to-date numbers. But at the moment, that doesn't seem to be an issue that we've heard about.
Yeah, and just to add, Kellyanne, there is some changes in stability data that we've gotten and instructions. So some doses that don't get used at the end of the day can be used the next day, which wasn't the case before. But now we have a 24-hour window to use those doses, so should be happening less.
So that's great. Wondering about with July 1st quickly approaching and now with the change for the Atlantic bubble, but more in particular for July 1st, for those who only have one dose but can enter as long as they present a negative test or receive a negative test if they want to leave self-isolation, what will our capacity be like to turn over tests quickly here in the province?
According to existing data, the turnaround test physically in the lab for a PCR runs between 7 and 8 hours. The main challenge that we have is simply one of transportation because they're all done one geographical location. We have significant capacity. There are discussions going on across the regional health authorities about some of the more routine testing for COVID-19 that's been going on and whether or not that would need to continue as our case counts drop. So we're not aware of any significant capacity issues. We could do theoretically now between 6,000 and 7,000 tests a day, and reagents and supplies have not been a factor in this, be they swabs or the reagents for the machine. So our regular check-in with the provincial laboratory has not revealed any issues there.
Thank you.
I will now go back to Reach Reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do. I'm getting a lot of questions from people who may be arriving the last week in June, for example, and are fully vaccinated. July 1st, the rules change. What does it mean for people who arrive shortly before that date? Does that mean, like you were saying with the Atlantic bubble, they'll be able to end their quarantine on July 1st, or are they stuck with the 2 weeks of isolation that applied when they arrived?
Yeah, thanks, Peter. So we're working to try to answer those questions. Our goal is that it would be similar to the Atlantic bubble and that the rules at July 1st that apply to you would apply to you. So if someone was fully vaccinated, they would be able to leave their isolation. However, it is going to require a little bit of time for us to work through how that exactly can happen, and so we'll have more information about that as we get closer to the reopening date.
Thanks.
Peter Jackson with the Telegram, do you have a final question?
I do. For all us budding virologists out there who might be confused about all this talk about a Delta variant now, this is apparently the subtype of the one first detected in India. How different are the Delta and Kappa variants? Is there much of a difference? Because people, I think, are probably a little confused about that.
Peter, again, that's outside of my scope to talk about the actual differences between the variants. What we know about this, so the Delta variant is 1617.2, and this is the variant that we are seeing, or the sublineage, we call it, that we are seeing in Canada and in most of the world. In the UK, they're seeing it right now as well. So it's mainly, the Delta variant is the one that we're mainly seeing. And, there are some differences with that, say, compared to B117. It seems to be more infectious. It may cause more severe disease. So there's some indication that may be the case. So we're watching it very closely, and that's why we're so keen to kind of stamp down on any outbreaks of this variant that we can. The actual difference, the Kappa variant, we just haven't had a lot of experience with, and I don't know that we can sort of make any larger blanket statements as to what the differences actually are, but they're subtle.
Okay, thank you.
Richard Duggan with VOCM. Do you have a final question?
I do. I've seen some reports recently about officials investigating heart inflammation in some people who have received their second dose of mRNA vaccine, although there hasn't been a link to the vaccine determined yet. Dr. Fitzgerald, I was wondering if you could explain what you know about this possible side effect.
Yes, so there is some concern, and there has been a signal, I guess, that has come up regarding inflammation in heart tissue or the tissue surrounding the heart. So we call that myocarditis, pericarditis. What we know right now is that it does appear to be happening in people who are younger, and males more so than females. We know that it appears that the vast majority of cases are actually quite mild. People recover usually fairly quickly afterwards. With regard to is there a causal relationship there between having the vaccine and the actual inflammation? That question has not been answered at this time. What we know about this type of condition is that, as opposed to the VIT that we saw before, the thrombotic, the blood clot disorder that we saw with the viral vector vaccines, this one is not quite as rare in the general population. So, we need to know, is this a true signal or not? First of all, that's the question we have to answer. Then we have to say, can we link it to the vaccine? And then is there a plausible biological mechanism by which the vaccine could cause this condition? So those questions haven't been answered yet, but what we and most of the evidence is coming out of the United States and Israel, who are doing quite intense surveillance for this as well. And so what we have learned from that to date, and the evidence is still evolving, is that it appears to be more so after second dose, and that it seems to be a mild condition that resolves on its own in the vast majority of people. The vaccine is still safe. These are still very rare events that are happening. Most important to remember, in the millions of doses of vaccine that have been given, we're not talking about a large number of cases at all. So these are still very rare events, and the vaccine is safe. We still would recommend that people get vaccinated with 2 doses of a COVID-19 vaccine.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
Yes, thank you. In regards to the second doses, I just want to clarify, anyone after August 6th will have to reschedule, and they can get either. But for those who are between 12 and 18, do they still have to stick with just Pfizer for their second?
As of right now, yes, Kellyanne, thank you for asking that question. They will still have to stick with Pfizer. We are hoping that Moderna is going to be coming out with a similar recommendation eventually, but we're not there yet. So for right now, anyone between 12 and 18 will have to stick with Pfizer.
Thank you.
Thank you, everyone. Minister, do you have any final comments for today?
Just briefly, again, we're still in a transition phase, and even when we go to step one, keep your distance 6 feet, wear a mask, and take advantage of first and second doses to get yourself fully protected. And by protecting yourself, you protect your loved ones and the community in which you live. So thank you very much for your time, and have a good day.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
Know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.